Good day, ma'am.
Good day po.
Ako din siya may tabermeho, imong student nurse karong nga day. Then, okay ra ba ma'am magkanda ko mga questions gamay sa imo nga about sa imong eyes?
Oh,
Okay na ma'am?
okay ra.
Okay. Pwede mo lingkod?
Okay.
Okay. Sige. So, naku yung mga gamay nga questions, ma'am. So, di lang makaka-busy, ma'am.
Dili ra.
Okay. So, ang first question, ma'am, is makakita ba ka sa imo ang vision, ma'am, og mga spots, floaters, sa front sa imong eyes?
Wala.
Wala. So, normal lang.
Normal lang.
Ako, ma'am, sunod is, naka-experience ba ka blind spots?
Wala po.
Wala. Maayo mo mo kay usod ba kay ni mata. So, nakasin na ba ka og halos or rings around sa lights?
Wala po.
Good. Good. Na ba kay trouble seeing at night?
Sahay.
Sometimes. Paano, ma'am? Naka-experience ba ka double vision or diplopia?
Wala.
Wala. No. Paano, ma'am? Do you have any eye pain or kanang magkatol yung mata?
Kuan. Pagsakit.
Sakit lang. Kuan, ma'am? Kuan baka, I mean is, anang sakit ba o kanang makakuan ka hayag kayo?
Hayag ko.
Yes. Kuan, ma'am? Na ba kay redness or swelling sa imong mata?
Wala.
Wala. Kuan, ma'am? Excessive watering or teary eye?
Oh.
Teary eye lang.
Paring
Tearing eye. Both eyes ba, ma'am? Or
both
both eyes? And then, have you any eye discharge?
No.
Except sa kuan, kanang mata lang tanong, kanang usually na dito sa mata, no? No? Kuan, ma'am, have you ever had problems with your eyes or vision? Napaka problema? Sa mga
Wala.
mata? Wala. Good. So, eye surgery?
Wala po.
Wala. Good. Any kanang eye problems? Wala.
Wala.
Medication, surgery, wala.
Wala.
Wala man, so walay kuan ma'am pas ni mga surgery. So wala ko kay treatment. Kuan ma'am, wala man kay kuan. Kanang wala ba kay gina-apply nga treatment sa imong mata like eye mo?
Wala po.
Wala po. Naka-experience na mga eye exam or when was it?
Wala po.
Wala po. O, kuan ma'am, do you perform the test, the muscular degeneration using the Amsler chart?
Wala.
Wala. Okay. Ano, ma'am? Wala ba kanang gi-prescribe mag-use og eyeglasses para lang sa radiation or lenses? Wala. Hon, ma'am, have you ever tested for glaucoma? So, na ba history eye problems sa inyong or vision loss in your family?
So far, wala.
So far, wala. Good. And then, na-expose ba ka, ma'am, sa mga chemicals na makaharm sa inyong mata? Ano?
Wala.
Okay. So, if ever magkuhan ka, ma'am, ma-expose ka og mga harmful na substances, nag-aware ba ka og mga protective or wear safety glasses?
Oh.
Yes. And then, nag-aware ba ka sa sunglasses, ma'am? O mag-expose ka sa sun?
Oh.
Like, kanang regular na lakon mo? Okay, yes. So, na ba kayo vision loss?
Wala.
Wala. Good. Mayo. So, wala naman. So, if ever man ka mga so, kan ma'am, what visual aids do you use to assess you with your visual loss?
Wala.
Wala. No? So, yung pass na answer, wala to pick. Kan ma'am, describe your typical diet, what you have eaten in the last 24 hours. Typical
Kuan.
diet, sa ano naman?
Rice, boiled egg.
Mm.
Mura na.
Nawala na imong typical diet in a day.
Oh.
In last 24 hours, ma'am, sa imong gikaon. Like yesterday. Vegetables, fruits. Na ba kay vitamins, ma'am, or supplements?
Wala.
Wala. Nagapanigarilyo ba ta, ma'am?
No.
No. So far, mauro to siya, ma'am. Thank you kayo sa mga oras, ma'am. Thank you kasi mong pagtubag sa akong mga pangutana. Salamat, ma'am.
First, we should gather first the equipments needed for the physical examination of mouth, nose, throat, and sinuses, which is the Snellen chart, handheld Snellen chart or near vision screener, pen light, opaque and opaque card, and ophthalmoscope. Also, the second one is explain to the client the procedure of the physical examination and do the proper hand hygiene. And to begin the physical examination, first is you should assist the client for vision using the Snellen eye chart, and then have patient stand 20 feet from chart and test each eye of the patient separately, having patient cover opposite eye, and then being tested then together with and without corrective lenses. Note that smallest line of patient is able to read with no more than 2 mistakes. And next is have patient differentiate the patterns of color on color plates or identify color bars on Snellen eye chart or identify figure embedded in the Eshishara chart. Next is assess near vision to the client or have patient hold packet vision screener about 14 inches from eye, or the normal acuity is 14/14 with or without corrective lenses. May use print size pictures if patient unable to read. And next is peripheral vision. Assess ability to detect movement coming in from the periphery inferior, superior, temporal, and nasal fields. And there are first is stand in front of the patient, face to face about one and one half feet apart to the patient. Ask patient to fix gaze straight ahead and cover one eye. Bring a pen or wiggle your finger in from the periphery from 4 different fields slowly. And have patients say now once objects are seen. And measure degree of peripheral vision using patient's fixed gaze as a base, or the superior 50 degrees, inferior 70 degrees, and temporal 90 to 110 degrees, and 70 degrees and 60 degrees. So, or the alternative method, compare patient's peripheral vision with yours. And the second one, for the extraocular muscles, for the physical examination of the client, first is the corneal light reflex. You should inspect the eyes for the parallel alignment of the patient. Shine light directly in patient's eyes. Note position of the light reflection and of the cornea in each eye and look for the sparkle of the eyes. Next is cover and uncover test. Cover patient's one eye and have patient focus on the object afar. Uncover and note any drifting of the eyes. And next is cardinal fields or gaze test, or the test he entered fourth and sixth. Stand in front of the patient and instruct him to fix, gaze straight ahead, and instruct patient to follow your finger of an object such as pen through 6 cardinal fields. Note patients to do so and note any nystagmus. For the external eye structure, inspect general appearance, clarity and parallel alignment of the patient in the external eye structure. Note symmetry, distribution of eyelashes, and inversion or eversion. Inspect eyelids for color, lesions, edema, lid log, and symmetry of palpebral fissures, or the opening eyes between upper and lower lids. Next is inspect eyebrows of the patient for shape and evenness of hair on the patient's eyebrows. And inspect position of eyeballs, or the alignment of sockets protruding or sunken. Next, inspect lacrimal glands located below the eyebrow of the patient and nasocomical duct. And note that the color, the edema, if there is edema, excessive tearing or drainage of the lacrimal ducts located on the inner punctus or puncta. Examine palpebral conjunctiva by gently pulling lower lids down. To examine the bulbar conjunctiva, use a Q-tip and gently roll eyelid up. Assess clarity, color, texture, moisture, lesions, and foreign bodies on conjunctiva. And inspect the sclera for color, moisture, and lesions or tears. Assess the cornea and lens by shining in a light on the cornea from an oblique angle. Note the clarity, lesions, and abrasions. Assess the corneal reflex testing for the client. Take a whisk of rolled cotton, gently touch the cornea, or take a needleless syringe filled with air over cornea. Note blinking and tearing. And also assess iris for color and shape of the client's eye. Assess the pupil size of the client, quality, and thus pupillary reaction to light. Also have patient look straight ahead. While you bring light from the side over the eyes. Note the reaction, the patient's eyes, and speed in both eyes, or the PRRLA. Next is accommodation, or the adjustment of eye for various distance for the client. Hold your finger of an object in front of the patient from a distance of 14 inches from patient. Instruct patient to focus on finger or object while you move finger or object gets closer. Note convergence of eyes and constriction of pupils as object gets closer. Next is assess anterior chamber. Have patient look straight ahead as you shine a light from the side across the eye. Note clarify and shadowing from the iris of the patient. Gently palpate the globe of the eyeball below, here in the eyebrows, and note firmness with fingertips or thumb on upper lids of the sclera. Note consistency, tenderness, but do not palpate eyeball with patients with eye trauma or known glaucoma. Now, objective data for the internal eye structure. Inspect the red reflex by using an ophthalmoscope. Stand 1 feet from patient at 15-degree angle from patient's line of vision. Place index finger on the lens well and turn wheel as needed to focus. And keep free hand on the patient's forehead to determine distance. Shine the light beam toward the client's pupil using the pen light. Inspect optic disc by using ophthalmoscope. Focus on the pupil and moving very close to the eye. Rotate the diopter sitting until the retinal structures are in sharp focus. Inspect retinal vessels using the above technique. Note the size, color, diameter, arteriovenous ratio, and arteriovenous crossings. Also, inspect retinal background for color and the presence of lesions. Inspect the fovea and macula, temporarily located opposite the optic disc. Note the color, lesions, and vessels of it. Inspect the anterior chamber of transparency.